Hey, thanks so much for joining us here on 9 News Plus. I'm Chris Bianchi and joined by Dr. Payal Kohli, our 9 News resident medical expert, all things expert. And today, Dr. Kohli, I want to focus in on allergies specifically because that has been a real topic of discussion. A lot of irritating. I can tell you firsthand, I'm getting all sorts of allergies, been sneezing like crazy. And so kind of want to break down maybe some of those ways to treat allergies and also maybe a bit more about what you're experiencing and also whether it's COVID or something else, kind of some of those differences. So start things off by asking a bit more. It is the peak of allergy season right now. We're in May. When is typically the kind of peak for allergy season? When does maybe some of those worst feelings start to drop on off?
You know, I would say we still have a couple more months, Chris.
Okay.
Yeah, so
Bummer.
May is kind of the peak, and then we see some in June, and by July, which is kind of the middle of the summer, it really does start to taper off. Now, there are some people who have allergies year-round because they're allergic to household things like dust mites or cockroaches or mold in their shower, what have you. So some people can have symptoms year-round, but the seasonal allergies where we're talking about the pollen and the trees and the wind blowing, those really do start to taper off in the summer.
Well, it's been a windy spring. You mentioned the wind. Does that really kick up pollen?
It really does, honestly. And for my patients that are allergy sufferers, I actually tell them to listen to Ed and watch the forecast as to how windy it is when they decide whether they're going to be doing something outdoors or whether they maybe need to take an extra dose of their antihistamine or something preventively. Because especially if you're allergic to pollen, and a lot of people don't know what they're allergic to, when pollen is a big one, and you go outside and it's windy, it's really kind of just flying up in the air. It's aerosolizing those pollen particles and kind of pushing them right up into your nose where they create that inflammatory reaction.
Did not know the wind had such an impact on allergies.
Yes.
So with that in mind, how do you know, and this is a key question obviously right now, how do you know if it's allergies, it's COVID, or it's something else? What's the main difference?
Oh, this is such a difficult question. So before we had vaccines, it was easy, right? Because the minute you have fever, the minute you have shortness of breath or involvement of your chest or your lungs, you know that it's COVID and it's not allergies. But now with vaccines, it's made it really much more challenging because the symptoms overlap even more. Those immune activation symptoms that we're seeing, which is like a little fatigue, congestion or runny nose, maybe a little bit of a scratchy throat, those can all occur with allergies and with COVID. Now, some that specifically don't occur necessarily with allergies are muscle aches or pains. So, you know, when you have the flu, you feel kind of achy, and that usually doesn't happen, you know, with an allergy. And then fever similarly. If you're starting to get a fever, even if it's a low-grade fever, that's pretty unlikely with allergies. But I would say 100% of the time, even if you're an allergy sufferer like myself, if you are having some symptoms that feel unusual or slightly different, you have to get that test to make sure that they're not real. And it's not just the rapid test that you can rely on. You actually have to follow it with the PCR test, especially if you think you might have had an exposure, like you're going out, seeing your friends, and what have you.
Okay. Good advice there. Probably misdiagnosed myself with COVID a million times this spring. With that in mind, you were telling me about something called immunotherapy, allergy shots. So tell us a bit more about those.
Yeah, you know, treatments are limited. Most of the times we just treat the symptoms, but this is actually trying to treat the core of the problem, what is causing the allergy in the first place. And what is an allergy? An allergy is an overreaction of your immune system to an innocuous antigen like pollen. So your immune system sees the pollen, it thinks it's an invader, and it goes to war, and it's that going to war that actually causes the symptoms, not the pollen itself. So you essentially want to take these shots to train your immune system to stop reacting. So what they do is they give you escalating doses of, let's say you're allergic to a specific type of pollen, that specific pollen, to induce the immune system to slightly react each time. But every time they give you a higher dose, the immune system says, oh, I've seen this guy before. He's not so bad. Let me not react as much this time. So it's a way to sort of retrain your immune system to not react to those antigens. And I've personally had the allergy shots, and they kind of suck when you get them because, you know, you do get a reaction and your arm is red and itchy and what have you. But in some people, they can be very effective in keeping those allergies and sort of curing them in a longer term.
Are there other more common treatment options we should know about?
You know, so on a day-to-day basis, we want to take those antihistamines. You want to be really, really careful not to take anything that has a D on it. So Claritin D or Zyrtec D, you know, or Allegra D, because the D is a decongestant. And it helps you feel better because it clears up your nose and everything, but it can raise your blood pressure. It can increase your risk for cardiac arrhythmias. It's just not a good practice on a day-to-day basis. So I do take an antihistamine during allergy season every day. day, but I take one of those non-sedating ones like not Benadryl, but one of those newer generations like Zyrtec or Claritin or Allegra, but make sure it doesn't have that D in it. You want to drink plenty of water because especially during allergy season, you're having a lot of what's called insensible losses, which means that you're losing a lot of water because your immune system is, fighting this antigen that it's not supposed to fight. And then you can, of course, take, things like lozenges or cough drops or things like that to soothe your throat. You don't want to really be taking too much kind of cough syrup. Those throat sprays I'm not a big fan of because for 1 or 2 days they might help your throat feel better, but in the long term they can cause problems. And then the last one that I don't like is the Afrin, which you can squirt up in your nose to help kind of clear up your nose when you're going to bed at night. But using it for more than 3 days in a row can actually lead to long-term problems with the anatomy in your nose. It can lead to necrosis of the tissue in the nose. It can cause a lot of damage.
So it breaks down kind of the skin within there?
Because what it does, so when you squirt in that stuff, it's called a vasoconstrictor. So it causes the blood vessels to squeeze down, which means you have less fluid leaking out from the inflammation, so you feel better. But when it causes those blood vessels to squeeze down, it limits blood flow to the tissues in the nose that are thin and sensitive, and they need a lot of blood. And so if those blood vessels are clamping down for more than 3 days, those tissues start to decay and sort of become necrotic.
Wow, interesting. And I didn't know that about the Claritin D, that can lead to cardiac arrest. Do you mind walking me through how that works and what to watch for?
So it's basically it's a decongestant, which is a pseudo amphetamine. So it's not actually an amphetamine, but it's a pseudo amphetamine. Binds the same sort of receptors and leads to a lot of the same things, which is to decongest you. We want to squeeze your blood vessels down because part of the congestion comes from leaky blood vessels leaking out all of this inflammatory cells into your tissues. So it raises your heart rate, which means you're more tachycardic. That's why sometimes people can feel a little jittery after they take that. And it raises your blood pressure because it's squeezing those blood vessels down. And by raising your heart rate, and not in most people, but in some people who may have the right predisposition, you're a little dehydrated, you've had heart disease before, or you have electrolyte abnormalities because you're not, you're not drinking enough water or whatever, that can set you up kind of to have cardiac arrhythmias like skipped heartbeats, called PACs or PVCs, and sometimes some things that are even more concerning if you're using these drugs chronically over time.
Question, do a lot of the main things we do on a day-to-day basis that you encourage, so for example, drinking lots of water, eating a healthy diet, can that be especially helpful in combating allergies?
Very helpful, the water piece of it especially. The diet also, I would say, especially if you have food allergies, because some people also have food allergies. You want to be real mindful of that as well. But there's also a whole body of evidence that certain types of diets at certain types of year may be more beneficial. So you kind of want to make sure when you're very congested or whatever, you're not eating super heavy food that's very difficult to digest because your body's resources, so to speak, are tied up with your allergies, fighting this innocuous antigen. So you don't want to be putting stress on it by eating a big steak dinner or what have you. So you want to try to tailor some of your foods a little bit to how you're feeling and a little bit to, allergy prevention. And in general, as the summer months come, smaller, lighter meals more frequently are generally a better idea than kind of super heavy meals because those can, create more vasodilation or more heat in the body.
Okay.
Yeah.
So more salads, water, and that'll help out with the allergies a bit?
Yeah, and water-based things like fruit, watermelon, and it's really nice. That's the lovely part about summer. We have all these great fruits and nice long days for us to enjoy the food all day long.
Oh, that's true. I like that, but no steak dinners, unfortunately.
Well, I think you can, but I think you just want to be careful because especially if you're somebody who has pretty severe allergies, you're taking a lot of medications, those antihistamines can also affect the way your body digests the food. So you want to be careful. You want to be mindful of your current state. If you have some mild allergies, and I don't want you to feel restricted in what you can eat, but if you're taking medications for your allergies or they're pretty severe, those are the days you want to kind of be gentle on your body, so to speak.
All right. Anything else we should know about with allergies?
No, I mean, it's something that comes back every single year, but this year in particular, because of COVID-19, we're more mindful. If you are wearing a mask when you're outside, it will reduce the amount of pollen that you're exposed to. And I know we're not all wearing masks outside, but if we do end up wearing them, sometimes it can certainly help to do that. Change your mask frequently if you are wearing it outside, because it will get contaminated with pollen if there's a lot of wind or what have you. And then if you put it right back on, you're actually introducing those antigens close to your face.
Okay, so kind of recycle those frequently as opposed to obviously for COVID, you don't, well, I mean,
Right.
I know you need to recycle those every so often, but not as often.
But it's a little different, right?
Totally.
Exactly. Yeah.
Well, Dr. Payal Kohli, thanks so much for your time here.
My pleasure.